Yes, welcome again. Today is a good day that we want to deal with immunity, the cells of your body and immunity. You know, your body has a way that it destroys some bad some bad bacteria, pathogens, bad things that come in your body, and then you feel good. Now, today we want to talk about the immunity, the cells that help you with immunity. And you know, those cells are called white blood cells. They are called white blood cells. White blood cells are cells of the immunity. They are cells that help you to deal with problems when sometimes you can be sick and you don't go to hospital, you get better. Today we will know how your body works to help itself. Now check this out. Let's deal with white blood cells, WBCs. These white blood cells. White blood cells are several cells that help your body to deal with pathogens and the things that destroy your body when it comes to uh, germs, diseases, and sometimes when it comes to distractions of some things that cannot be cured, like viral diseases. You know, viral diseases, you cannot treat them, but you can stop the progression. So let's check out how the body works, how this body works, and how it helps ourselves to do what? To be healthy every time. White blood cells are also called leukocytes. Where will I write? Are called leukocytes. Leukocytes are also called leukocytes, you know. And there are several types of white blood cells like neutrophils, lymphocytes, monocytes, basophils, eosinophils, and eosinophils. So I will go one by one, step by step on all of these. Cells, these white blood cells are the cells of immune system that helps defend your body. They help defend your body against infections, foreign substance, abnormal cells, and diseases. Now, let's start with, or let's name the ones, let's name again. We have neutrophils, we have lymphocytes, we have monocytes, we have eosinophils, we have basophils. Mm? But you see, the lymphocytes are divided into uh, B, B, B lymphocytes, T lymphocytes, and then we have NK, natural killer cells. Those ones work on viruses. They take the virus, destroy them, and they send them away from the body. Now, let's talk about the neutrophils. Yeah, the neutrophils. What are the neutrophils? White blood cells. But the main functions of the neutrophils. What are the main functions of the neutrophils? What do we know about the main function of the neutrophil? They are the fast responders. When you get a bacterial infection, they are the fast responders at the site of infection. Hmm? Destroy the germs by engulfing them, by engulfing them. You know, the process of engulfing. Now, you look at this. This is a bacteria. This is a bacteria in red. So the process of engulfing is it comes around it, forms a pseudopod, engulfs it, releases some toxins or substance of neutralizing this bacteria, destroys it and releases it. Chemicals destroy this bacteria and releases it in the bloodstream to be eliminated out of the body. That is the work of neutrophil. The engulfing process is called phagocytosis. Phagocytosis. Yeah? It helps by releasing toxin enzyme. Phagocytosis is the process is called phagocytosis. Phagocytosis, releasing enzymes to destroy this bacteria, then it is destroyed, so it cannot affect your body. That is the first thing that we know. We push this one here faster. Now let's talk about something else that is called factors about neutrophil. Factors about most abundant, they are most abundant, 50 to 70%. When you do a few limogram, you see them they are above 50% to 70%. Importance in acute infection and an infection that just happened. You know, acute infection is the infection that has just happened. It's the infection that is not chronic. It's not a persistent, an infection that is not persistent. You see, so uh, let's talk about something else that is important. Uh, these are the, the, the neutrophil are the ones which form pus. When most of them die, they form pus. You know, pus is what you can get in a boil, an abscess, accumulation of pus. Yeah, by some bacteria that die, they form neutrophils, and then you come up with pus. And they are increased in bacterial infection, stress, burn, and steroid use. So stop using steroid use because most of the steroid use destroys your immunity. Steroids reduce your immunity. But these cells, when you are undergoing chemotherapy, those that undergo chemotherapy like in cancer, bone marrow failures and severe infections, they are decreased. So if you get a full hemogram, you check and then you see the neutrophils are decreased, you start thinking of cancers, you start thinking of uh, bone marrow problems and severe infections. Let's talk about lymphocytes. Lymphocytes are divided into B lymphocytes and T lymphocytes and natural killer cells. B lymphocytes, T lymphocytes, and natural killer cells. So, the main functions of these fight viruses and control immune responses. The main function, they fight viruses and control immune responses. Like the B lymphocyte, B cell, they produce antibodies, create immunity memory after infection. You see, when soldiers want to go and fight, when soldiers want to go and fight, what do? They start learning the tactics of the enemy. They start learning the tactics of the enemy. So what happens here is, when you are infected, the B lymphocytes are the ones which form. They start learning the enemy. And there was something that we used to draw, like if this is the shape of the enemy, the B lymphocytes will come up and come to learn this is the shape. So they form something like this to come and fit in here. So this will not destroy your body. You see, they know how to form, they check how the enemy, the bacteria or the virus is. So when it is released, what it does is it starts to form those shapes to know how to fight it. Not really shapes, they start to learn how to fight the immunity of this this enemy. How does it destroy your body? Which enzymes does it release to destroy your body? How can it fight it? It produces antibodies. Antibodies are like the enemy, but it's your body which is learning it so that it can learn how to destroy it. And also creates immunity memory, like vaccines. When you are given a vaccine, the B cells, the B lymphocytes are the ones which create the antibodies to have a memory so that when one day you will be exposed, what can you do? You can you can know, the body can know how to fight it. You see, now let's talk about a very important thing, the T cells. The T cells, what are the T cells? Now T cells attack infected or cancerous cells. They attack infected cancerous cells and coordinate immune responses. They coordinate immune responses. So these ones attack infected cells. If you have a cell in your body that is infected by a virus and the virus is undergoing the replication, translocation. It attacks it before it releases more virions. Virions are small viruses. You see, let's talk. There is another one which is so important, which is very important. Natural killer cells. Yeah? Kills viruses, infected, and tumor cells. These ones, they kill viruses, infected, and tumor cells. Tumor cells are cancer cells. They attack them directly and they kill them. So the lymphocytes are about 20 to 40% of white blood cells. Check on your one day on your full hemogram. You'll see the variation. You see, and they are increased when someone has cancers like leukemia and viral infections. Viral infections, they are key when it comes to viruses. You see, so those ones are the lymphocytes. The lymphocytes are part of your body that helps you when it comes to viruses and and other problems like cancers. We have the monocytes. Monocytes clean up dead cells and microbes, become macrophages in tissues. Their work is to clean up, destroy what when the neutrophils have done their work, they have destroyed the lymphocytes, have destroyed the B lymphocytes, T lymphocytes, natural killer cells, have destroyed the the bad cells, have destroyed the pathogens. The pathogens are bacteria, yeah? Like the virions, the viruses. It is the work of the monocyte now to come and destroy, to come and clear. They phagocytose. They phagocytose. Activate other immune cells, help in chronic inflammation. They activate other immune cells. The key fact is largest white blood cells, because your body have to clean all the dirty, all the viruses that are dead, all the bacteria that have been destroyed. They have to be removed from your body. They have to be removed in your body. Now, we have some situations when they are increased. We have some situations. You have got it. Umepata? Dorothy? Umepata? Okay. Now, they have to be removed from your body. Now, these ones are increased in TB, chronic okay, prepare, I'm coming. Chronic infections, immune diseases, autoimmune diseases. Autoimmune diseases destroy your body directly. They destroy your body directly. Now, we have another one that is called the eosinophils. Eosinophils are main functions are they work in parasites like worms. You know, just like other bacteria, they are microbes. They are small things that you can't see with your open eyes. We have other bigger like parasites, like worms. I can say it like Tinctura tincturaris, yeah? Tincturaria bancrofti that brings in another bacteria. When you learn about tropical medicine, you will know about these parasites. Most tropical medicine, you will learn about these parasites at large. Even malaria parasites, hmm? Oval, falciparum, malariae, when they come to your body, yeah, you see, and also the eosinophils. Eosinophils, they participate in asthma and allergies. Asthma and allergies. About 1 to 4% of white blood cells have an orange red granule under microscope. One day, when you go to the laboratory and look and you see an orange red granules under the microscope, just know you are working on eosinophils. We have said the increase in allergies, worm infection, some skin diseases, and allergies. Their main function is to trigger allergic reactions. Their main function is to trigger allergic reactions, inflammation, mediators of inflammation, prostaglandins that come, they vasodilate the area of inflammation, blood comes there, macrophages come there. When inflammation occurs, the key inflammatory response, redness, swelling, hotness, the key. They help your body to recover. And pain, because in the prostaglandins, when they come there, you feel pain. You feel pain. But as you feel pain and the dilation of blood vessels around there is happening, you recover. But here, eosinophils come to mediate and to do what? To destroy the others. And these ones, they release histamines, which causes swelling and itchiness. That's why when you get some infections of some parasites, you always feel like you are itching your skin and swelling everywhere because they release histamines, and histamine is a gas that releases some chemicals that swell, and it does what? You feel like you can scratch. Yes, asthma. You cough. So when you stop asthmatic release asthmatic condition by antihistamine, this is the gas that you are working on. Like the mast cells in your mast cells that release histamine. You are destroying histamine release. Heparin. Heparin prevents clotting. You see how things work. Science is a good thing because you deal with the reality. You deal with the reality. Yeah? You see. Now let's get to continue with basophils. They are less like 1% of your body in the bloodstream. 1%, less than 1%. Increased in allergic disorder, chronic infections, and certain blood cancers. Certain blood cancers, you can find them. You can find them. So um, uh, you see, someone told me one day, uh, when you want to remember them, you say never let monkey eat bananas. My friend who was a teacher one day told me, never let monkeys eat bananas. Yeah? Never let monkeys eat bananas. Yeah? Neutrophil lymphocytes divided into B lymphocytes, T lymphocytes, and natural killer cells. Yeah? And then we have monocytes. Monocytes, we have eosinophils, and we have basophils. You see, now that is a session of how your white blood cells help you to maintain immunity. So, my friends, welcome, and don't forget every day at 16:30 Kenyan time, 4:30 Kenyan time, 4:30 p.m. Kenyan time. We are always there to discuss matters concerning health and matters that help us to live a good life. So be there, stay tuned as you visit the site, check if you have subscribed. Subscribe to the channel. Don't forget to subscribe to the channel, my friend. And do what? Like every video. Let's go together. And if you have a question, just text on one of the videos or the email address that is always given. You see? Thank you for tuning in. Stay blessed. Let's meet at 16:30 daily. If you have a question, don't forget to ask. Bye bye. See you guys.